Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. So today in this video, I will explain about high blood pressure and give some tips for you guys to avoid the symptoms of high blood pressure. Well, before I'm going to the whole video, I would like to introduce myself first. My name is Baiq Abidah Ardelia with student number 2021-12-500-106 and I'm class of R4B. Alright, without any further ado, let's get to the explanation. Okay, the first one is definition of high blood pressure. So, high blood pressure, or also known as hypertension, is a condition when blood pressure is at 130 per 80 mmHg or more. If not treated immediately, hypertension or high blood pressure can cause serious life-threatening illnesses such as heart failure, kidney disease, stroke, and even cause of death. The term blood pressure itself can be described as the force of circulating blood against the walls of the body's arteries, which are the main blood vessels. The amount of pressure that occurs depends on the resistance of the blood vessels and how intense the heart is to work. Someone can get high blood pressure when more blood is pumped by the heart and due to the narrowing of the blood vessels in the arteries. Hypertension can be known by routine checks on blood pressures. It is recommended to be done annually by all adults. Hypertension is divided into two types, namely primary and secondary hypertension. The following is an explanation of the causes of this hypertension. First is primary hypertension. Often, the cause of hypertension in most adults cannot be identified. Primary hypertension tends to develop gradually over years and eventually get worse if left untreated. 2. Secondary hypertension. Some people have high blood pressure due to an underlying health condition. This type of hypertension tends to occur suddenly and causes high blood pressure than primary hypertension. Okay, next is symptoms of hypertension. There are symptoms that can be felt by people with hypertension, but keep in mind, not all people with hypertension will feel these symptoms. Often, cases of hypertension are found in asymptomatic patients. Some of the symptoms of hypertension are as follows. First one, headache, especially in the back of the head. Next is vertigo, tinnitus, buzzing or hissing in the ear, vision problems, hard to breathe, pain in the chest, arrhythmic conditions, and fatigue. Next, hypertension risk factors. Indeed, the risk factors for experiencing hypertension are directly proportional to age. Someone who is older has a greater chance of experiencing hypertension. Several other risk factors that can increase the occurrence of hypertension are: first, have over 65 years of age, often consume food high in excessive salt, are overweight or obese, there is a family history of the same medical condition, less consumption of fruits and vegetables, not physically active or rarely exercise, consuming too many foods or drinks that contain caffeine, have a smoking habit, many consume alcoholic beverage, stress. High stress levels can temporarily increase blood pressure. Have certain chronic conditions such as kidney disease, diabetes, or sleep apnea. Next, complications or effects of hypertension. Hypertension that is not treated properly can cause the sufferer to experience complications. Even worse, complications from hypertension can lead to death. So, what are the complications of hypertension that can be dangerous and should be watched out for? First, heart disease. Next, kidney failure, visual impairment, cognitive change, and cause of death. Okay, next, how to deal with hypertension. How to deal with hypertension must be done medically so that the handling is right and doesn't worsen the condition. People with hypertension are generally required to take medication for life so that their blood pressure can be maintained. However, there are several conditions in which people with hypertension can lower their dose or stop taking the drug, especially if their blood pressure is under control by adopting a healthy lifestyle. Medicines that are commonly prescribed by doctors for people with hypertension include: first one is drugs to dilate blood vessels so that blood pressure decreases. This is because hypertension can sometimes cause blockage in blood vessels. Second one is medication to get rid of excess salt and fluid in the body. Later, the disposal of excess salt and fluid will come out through the urine. Next, drugs to slow the heart rate. Blood pressure lowering medication. And then angiotensin blocking drugs, where angiotensin serves to increase blood pressure. Okay, and the last is tips for preventing hypertension. There are several steps that can be taken to prevent hypertension, namely, eat healthy foods such as fruit and vegetables, limit salt intake to less than 5 grams daily, reduce excessive consumption of caffeine, quiet smoking, ever exercise regularly, maintain weight, reducing consumption of alcoholic beverage, limit your intake of foods high in saturated fat, eliminate or reduce trans fat in the diet. Alright, I think that's all for my explanation and tips for today's video. I hope this video will be useful for us. I apologize if there's something wrong when I make this video. Thank you so much for watching. Wassalamualaikum warahmatullahi wabarakatuh. See you and have a good day.